started. My name is Zakaya, and I'm going to be your nurse for today. Today, we're going to be doing an assessment of your mouth, your throat, your nose, and your sinuses to check for any abnormalities. If you could you tell me your name, your date of birth, and your age?
My age is 6. My birthday is August 30, and my name is Carter.
Okay, so next, we're going to start the assessment. I'm going to start by assessing your mouth. So I'm going to check the lips, the gums, the teeth, and the buccal mucosa. So the lips are pink. Let me see your teeth. Cheese. Okay, the teeth are white. They're smooth. A few are missing. Let me see your gums. Let me see cheese again. Say cheese again. Okay, the gums are not swollen. They are pink. Now I'm going to check your buccal mucosa. So can you open your mouth for me? I'm gonna pull this to the side and I'll test it. Pull it. Okay, they're visible and they're pink. All right. So now I'm going to go on to inspect the tongue. Could you stick your tongue out for me? I'm going to check for the surface characteristics, check for any lesions. There are no apparent lesions in your mouth. Now I'm going to inspect the ventral surface of the tongue. If you could you raise your tongue to the top of your roof? Lift your tongue to the roof of your mouth. Open your mouth wide. Now lift it to the top. Okay. Ventral surface is good. The frenulum and the Wharton ducts are visible. All right. Okay, so now we're going to go on. We're going to test the hypoglossal cranial nerve. So put your tongue inside your mouth like that. Yeah. So we're going to test it. All right. Okay, now we're going to go on to assess the throat. So let me see. Open your mouth wide. I'm checking for odor. How you tilt your head over? I'm checking for odor. There's no odor. I'm going to inspect the pharyngeal wall. Open your mouth back up, love. Okay. The pharyngeal wall, the hard and soft palates. Okay, they're all good. Now I'm going to go on and I'm going to inspect the uvula. Open your mouth for me. Stick your tongue out. I ain't gonna be able to see. Stick your tongue out. 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 Stick your tongue out. Let it down. Okay. The uvula is visible. Now I'm going to go on and I'm going to inspect your tonsils. Open your mouth back up for me. Stick your tongue far out. Okay, the tonsils are pink. They're about a grade 1. They are normal size. Okay, now I'm going to test your cranial nerves 9 and 10, which are the glossopharyngeal and the vagus. Okay? So we're going to check for your gag reflex. So you're going to do a little gag. It's going to be like, okay? So open your mouth. Stick your tongue out. Stick your tongue out. Did you gag a little bit? Huh? You felt it? Yeah. Okay. Oh, I also have to check the size of your tongue. If you could stick your tongue out for me. I'm going to put this on your tongue. I'm going to pull it to the side. All right. Good. Okay. Okay. Now that I've checked your gag reflex, I want you to open wide. Stick your tongue out for me. Say ah.
Ah.
Okay, the uvula does raise when he says ah. The gag reflex is good. The mouth, the throat area, the pharyngeal, the hard palate, and the soft palate is good. Yeah. So we're gonna go on to assess the nose. Are you ready for that? All right, we're gonna assess your nose. So I'm gonna change my gloves out. All right. Okay. So to start assessing the nose, I'm going to first inspect for the size and the color and its position, the symmetry of the nasolabial folds. Okay, everything seems to be good. The nose is centered. It is about the same color as the rest of the skin. It's about normal size, fit for your head. Now I'm going to I'm going to palpate your nose for any tenderness. Does that hurt?
No.
Okay. Now I want to palpate your sinuses. Let me see. That hurt? Any tenderness? Is this tender? Okay. Both the maxillary and the frontal sinuses are not tender. Okay. Now I'm going to inspect the internal part of your nose. So if you could lift your head up a little bit, tilt back. I'm going to look inside. Okay. The mucosa is pink. There's no visible bleeding. The nose is a little moist. Now I am going to test your sense of smell. So I'm going to get this. Could you smell that? Does it smell like a peppermint? Yeah. All right. All right. That concludes the end of the video. We've assessed the mouth, the nose, the sinuses, and the throat. Thank you.